Oh, it's 5:01, we're late. We'll call the meeting to order of the Health and Human Services Board on June 19th at 5 p.m. at the St. Croix Government Center, room 1284. Roll call, please.
Lisa Lind.
Present.
Sean Anderson.
Present.
Kathy Leaf is excused. Dave Osnes.
Present.
Greg Telejon.
Present.
Mike Barkalow.
Present.
Okay, Kathy Finley. Just wondering if she can hear us. Deb Lindeman.
Present.
Julie Smith.
Present.
We do have a quorum, so next item, approval of minutes. Is there any additions, corrections, or objections to the minutes that were published? Hearing none, they'll stand approved as presented. Tonight we have some public comment. First one I have here is Peg Audley. And there'll be a 2-minute time limit.
Is this on? Okay. Peg Audley, I'm from St. Joseph Township here. I want to comment about keeping our healthcare complex, our nursing home, assisted living, and rehab services. I think the whole state of Wisconsin, along with the country, is facing a growing demographic of an older population. That should not be a surprise to anyone. The tidal wave of baby boomers is in need of rehab, assisted living, memory care, nursing home care, and it's already a burden in communities across the country. And I think it's just going to get worse in the next 5 to 10 years. Couple that with the lack of people going into the field. You don't have any caregivers, so we have a shortage of staff. I don't care whether you're private or public. It's very difficult to find CNAs and nursing staff. So in my mind, we're already at a crisis point. So why would we now want to think about studying and selling this, privatizing our healthcare complex? It makes no sense. Why would we want to sell it when I think it was about 10 years ago, we had 2 referendums overwhelmingly supporting that we keep this in our own county. Will this improve the situation if we sell it? As I said, private companies are also in the same situation. They don't have the staff either. They're going to put up the costs. I don't know if any of you have tried to put someone in a nursing home recently. If you want a decent place, you need to come to the table 2 to 3 years of private funds, not come to the table already poor and going to be on Medicaid. So what you're doing by privatizing this is you're going to put people literally out in the cold of having choices. Chair Long reported his research showed 80% of the residents in the nursing home right now are from the New Richmond area, 20% are from the rest of the county. His rationale to consider studying selling to recoup costs, just when it seems to me we're beginning to make money, when you look at what Whipley said we were going to, what they predicted, we're actually in the green. He's troubled that 80% of the taxpayers are paying for the cost of that facility that they aren't using. I don't use 80% of the highways in this county, but I pay for them because I gladly want to be able to drive on them, right? I mean, let's look at that. Do we sell the highway building?
Time's up.
Oh, I was right at my point. So anyways, thank you.
I'm Charlotte Croix from Deer Park in the town of Stanton, and I just heard about this morning that the board is thinking of trying to sell the health center, which I am totally against. I think it was just remodeled or rebuilt just in the last few years, and like she had said previous, there was a referendum where the majority of the people in the county approved to keep it and keep it running. And I think this is what our local government is for, is to provide these services for the people. I just visited a friend there the other day, and she was so happy to be there now because she can't be at home by herself. She's just too crippled and falling over all the time. So it's a place where people need this service. And one thing, talking about public comment, I made a mention to her that I thought public comment maybe should have been made at the end, after we hear what everybody else has to say about it. I don't know if that makes any sense or not, but being that we just found out about this, and I just think that we need to keep doing the services. That's what local government is for, is doing these services for the people. And if the people of the county, majority-wise, voted to keep this, I think the county board should listen to the people. Thank you.
Thank you. Next presenter or public comment is Chris Babbitt.
Thank you very much for giving us the opportunity to talk a little bit today. This feels a little bit like a dream in the sense that I've sort of transported back to my time on the board from 2014 to 2018 when we were having, in essence, this same debate. This is not a new issue, as most of you know. The question about whether the nursing home should remain in county hands or not has been debated for a very long time. It was one of the reasons why the two referendums happened, because we wanted to know, how does the community feel about this issue? And being a part of a board that enacted many of the steps that made that reality, I think it would be a significant mistake to consider privatizing. I think that if you look at other situations where things like fire departments, EMS, other things, other government entities have been privatized, I think it's fair to say that the results have not been terrific. Generally speaking, costs have gone up, profits have gone down. I think, as you heard, we're still going to have trouble staffing, whether it's private or public. I just think that we've worked so long and so hard in this county to keep a first-class facility up and running. It would be a shame to really turn back that clock at this point and look at privatization. So I hope you'll all consider that very carefully as you move through the process of looking at the finances and other aspects of the question. Thank you.
Thank you. Next one is Susan Van Mealy.
I am Suzanne Van Mealy from the town of Troy, and I just learned about this about an hour ago, and I can tell you what my involvement has been with the county nursing home. In 2016, I was on the ad hoc construction committee for the nursing home, and also the grant from Fred C. and Catherine B. Anderson Foundation for that therapy pool, an amount of $380,000. They believe in their community. A lot of people believe in our community in this town, in this county. And in fact, in 2015 or 2016, there was a referendum right before building this nursing home, in which about 2/3 of the people, in the 60s, 63%, something like that, approved keeping the old nursing home. So that, people are compassionate. The government is about people as well as money. And as been said before, where do the poor go? If you turn this over to a private facility, you've lost the safety net of the people. What will happen to them, the poor people? Also, I agree. Public comment, this is all new to us, and we have a lot of studying to do about it and come up to speed. I just want you to keep in mind that government is not just about the bottom line and money. That's the corporate world. This is a government, and government is for the people. Thank you.
Thank you. Next person is Jill Berkey.
Thank you for the opportunity to make a comment. I'm Jill Berkey from the town of Troy, It's nice to see some of my previous fellow board members and staff members from New Richmond and certainly here in Hudson. I wanted to just talk a little bit about the fact that some of you here, like myself, perhaps remember in the 80s when the original nursing home in New Richmond was torn down and a new facility was built. And over the years, many improvements were made, as noted by Mr. Babbitt and also Suzanne Van Mealy. There were a lot of activities and a process in terms of rebuilding, having a new nursing home. And we felt very pleased about that, including the therapy pool, and including, at the time, the memory care center, on memorializing former legislator Kitty Rhodes. So I would ask that you consider compassion as you go forward, and keep in mind that there are some individuals, many individuals in the county and perhaps beyond the county, unlike some of us that don't have the resources for a care facility when that time comes. It may be as a result of not having family anymore. There may be individuals who have friends that care for them because their families aren't here. So I would just ask that you give serious consideration before making any quick judgment calls, and to look back historically. And I'm certainly available for further discussion in a historical perspective if you would like. Thank you.
Thank you. Last one I have is Sue Curtis.
Hello, I am Sue Curtis from the town of St. Joseph. Thank you again for letting us have some time to speak today. I too just found out about this morning, and as eloquently stated by Peg Audley, feel very much the same. It's a very short-sighted conversation if we talk about closing this facility, and then we know the issues with privatization. It's short-sighted because if we look at the population, so we're nearing 100,000, 93,000 was our last census, and there's 16% of us that are over the age of 65, including some of us in this room. So I may not use that service now, but I may in the future, or some of us may in the future. And of those 16% of us that are over the age of 65, and I'm guessing that's an older number, it's a couple of years old already, 7% of us are disabled. And this is the population that is the most vulnerable, so I ask that you just be careful in thinking about this. I know the argument would be that the privatization keeps it open, but we do know, in my own experience with my parents, that the larger the facility, the more corporate the facility, the quality of services seem to go down. So I just want to caution you on that as you move forward. Thank you.
Thank you. Is there any more public comment? Any other public comment? Okay, we'll close. I have a different topic. So we'll close the public comment at this time. Appreciate everybody giving their opinion. The next item is open public participation process, view letters, and take public testimony related to the 2025 Health and Human Services budget. Who wants, anybody have public comment on that? Or, okay.
Hello, everyone. I'm Leah Kaiser. I'm the Chief Financial Officer at Western Wisconsin Health in Baldwin, Wisconsin. And I'm here representing the leadership team and our staff and expressing gratitude for the funding that had been provided this year to help support our recovery support specialist role and services. And so what this is really funding that was provided to help with medication-assisted treatment for those seeking services and needing support. It was led by Dr. Nathan Schwartz at our facility and has been very well received and supported by the patients, and the facility is very grateful. So thank you very much for that support this year.
Thank you. I have a letter here, or email, from Kathleen Lauer that I need to be read into the minutes. I am a 76-year-old living in the rural community in Croix Township. I intend to stay in my home, but I will probably have transportation needs as my ability to drive diminishes. I need public transportation, and I noticed that the new rideshare program includes a per-mile charge for individuals outside the city limits. Why can't the county and the township contribute to this program so all residents of the county have access to affordable public transportation? That concludes her comments. Is there any other public participation comments? Hearing none, we'll move on to item 2, Health and Human Services monthly financials.
Thank you, Mr. Chair. Faith Strenke is off tonight on a well-deserved vacation, so you're going to have to deal with me on the financial report. But you go to page, are you on 12? All right, page 12 is the overview. I just wanted to point out a few things, and then I'll see if you have any questions I can answer. On the revenue side of things, we've seen an increase in building permits and inspection fees. That's almost doubled. We've seen an increase in substance use disorder treatment, the AODA, it's called, alcohol and other drug abuse, in both non-IDP, that's intoxicated driver program, and the IDP treatment fees. So we've seen increases in revenues there in mental health treatment and in donations and contributions, which is helpful. If we move to page 13, on the expense side, the main concern there, of course, is what we talk about just about every month in purchase services. That's in children's services and behavioral health, where the cost of high-intensity treatment environments is driving up those expenses in spite of our efforts to intervene earlier and prevent crises from happening in the first place. We're constantly monitoring our purchase service costs. We have some limited ability to impact that, and we're doing everything we can to reduce those costs. But we're, in the end, mandated to cover placement costs for some of these individuals. In children's services, I'll just note, too, that we were successful. That is, the children's services staff and Corporation Counsel were helpful in reducing the number of kids in out-of-home placement by about a third, about 30%. The problem we're seeing, though, is the kids that remain in out-of-home placement have very severe kinds of emotional and mental health needs that still require those high-cost environments. Sometimes those can cost as much as $500,000 a year per child. So those are the kinds of things that we're still struggling with in mitigating the costs around. The last thing I was going to point out, I think, is the catered food and unprepared food costs. You can see catered food went up because we switched to a catered food model in most locations, and the unprepared food or raw food costs went down, unfortunately not by the same amount. Working with Kristen Newton, the ADRC administrator, on strategies for how to reduce those catered food costs or keep them in check going forward. I think, the only last thing I would point out is the staff development cost. You might notice that compared to this time last year, went up about $20,000. A lot of those staff development or training costs are paid for through grants. So you see the expense there, but the grants pay for most of those. All right. The nursing home, quickly, I don't have it up in front of me, but the nursing home has seen the census stay up pretty high, and they've been able to do very well with their revenues. And as long as our ability to hire nurses and CNAs, which has improved lately, helps us reduce those costs around contracted services for CNAs and nurses. I think Sandy said we've been able to hire I'm going off memory, but about 4.5 nursing positions in this year, and several CNA positions were filled due to kids being out of school and taking those jobs. So we've had a little reprieve here in terms of costs related to contracted services at the healthcare campus. So I'll try and answer any questions you have, or maybe Ken can help me if I don't know.
Any questions? No. Good job.
All right, thank you.
Next item is review healthcare campus financials versus weekly projections pre-2016. Should I repeat that so they can record that? Review of healthcare campus financials versus Whipfly projections pre-2016 construction.
Wanted to make that a little bit bigger. I'm going to go back and point out something on the financials for the healthcare campus before we dive into the rest of the presentation. And that is, so institutional care, so that's the charges of services. So it's this line right here. It's the biggest line out of the budget. That's the revenues. But what you want to look at when you're comparing that is 2022 we had 6.3 million. 2023 we had 7.1 million. Last year through the end of May we were at 2.7, and year to date through the end of May in 2024 we're at 3.4 million. So we have a good trend going forward. So I wanted to point that out then as we go into the comparison then with our Whipfly numbers. All right, so this spreadsheet here with all the little numbers on it. The first part of it is the Whipfly report that was prepared back in 2015. What the county was looking at with their contract with Whipfly was what are the chances of the healthcare campus being able to contribute towards the debt service? Because we knew that in all likelihood the county was going to have to subsidize the debt service payments. So they did a 5-year analysis for 2016 through 2020. I then just took the same percentages and extrapolated them out for 3 more years to make it comparable for the years, which really kind of surprised me that it sort of just tapered off right there. Whipfly said we'd be good for a while, and then they stopped adding years when it turned bad. But that doesn't match necessarily our actuals. So if we look at the actual numbers then for 2016 through 2023, we've stayed positive all throughout there. So we got off to a little bit of a slow start. It took a while before we got our federal licensure to operate the facility fully. So 2016, 2017 was a slow start. 2018, we took off with a bang. Then we hit a pandemic in the middle there somewhere. I forget where exactly. That's just a joke, I remember. Hit the pandemic. We actually did get a lot of COVID revenues that year, so the bottom line actually looked really good for that year. And then, we've been steadying it out. So if you look at the accumulation of the years compared to where Whipfly thought we would be, we're ahead of that. So we've done better than the projections, and I really attribute that probably in large part to Sandy Hackenmuller, the nursing home administrator. She's done an excellent job of watching the expense side to match the revenue side. So when beds are full, she provides the staff to do that. And when beds go down, she reduces the number of staffing hours to match that. I think that's really probably one of the keys to the nursing home, because it's a service. We're providing that service. And if you're not matching the labor costs to the revenue costs, it can get out of whack really fast. So this proves that she's done a good job. She's not here tonight to hear it, but it's recorded. She can play it back as often as she likes. So that's the financial analysis. Now this is done on a cash flow basis. So I do want to tell you what that means. So we record, we really keep 2 sets of books. We keep the set of books for GAAP accounting. It's an enterprise fund. We treat it just like a private business. So we have depreciation and other accrual entries that affect the bottom line. And so while we normally look at the budget and financial reports on a cash flow basis, it's just what's the revenue and what's the expense. This is what's being shown here. That may not look, if you look at the financial report at the end of the year, you may say, well, there was a loss that year, or the revenue wasn't that big. Well, there's other book entries that are affecting that. So we built a $21 million facility, and we're depreciating that. So just like a business would, we divide that over 27 and a half years, depreciate that out, and so that's adding to some of the expenses, book entry expenses. That money's not going anywhere. It's a accounting journal entry. So I wanted to point that out as a difference from what you see on the cash flow, because this chart here is showing the fund balance. So back in the early 2000s, we were in the positive fund balance. I really believe at that point in time that the county was using tax levy to subsidize the healthcare campus. That's my understanding of what was happening. And so when they were in the black, they had a positive fund balance. It's because tax levy dollars were coming over to subsidize that. In 2011, probably about the time that Pat Thompson got hired, that policy changed, and there weren't tax levy dollars going over to the nursing home. And you can see that they really dipped down into a negative. They were posting losses annually, and that kind of accumulated, and they stayed in that territory. But because of the positive performance from the nursing home, we've been able to turn that back around, and they've come back into the positive, even with the accrual entries. So this is with the accrual entries added in there. Really what we want to see is about 10% of our expenses, which is where this bottom orange bar is. That's where we want to get to. Once they get to that point, I would start recommending that the excess cash surpluses be used to pay for debt service. And that's probably where the biggest question mark comes in. So we took out a 20-year loan. We've paid 9 of the 20 years. We have 11 years left. There's still $15 million outstanding. And the healthcare campus hasn't contributed to any of that. The taxpayers have been paying all of those bills. And the next 11 years, they range from $1.5 million up to $2 million per year. So that's what the taxpayers are currently paying and will pay over the next 11 years, really instills subsidy of the nursing home from a capital side. And so it's not quite there where they're going to start contributing to that yet. And that's where the question, I think, on the healthcare campus has always come in is, why are the taxpayers subsidizing it? Can't they pay for part of that? But this financial analysis sort of tells you where we were, how it looks, and kind of the time frame of when it looks like we might get there. I would say that we're maybe just 2 or 3 years away from getting to that point. So that's why the analysis was done. And at the end of the day, it is entirely up to the 19-member county board of what you want to do as a policy decision of whether we keep the healthcare campus, whether we sell the healthcare campus, or whether you change any of the other internal policies related to it.
Taking questions, or
Yeah.
anybody have any questions or comments?
Okay, yeah, I got one. Where do we see the figures right now on where we're at with the rehab unit that's up there? I know that a few times that I've been up here lately, the numbers are just increasing. They got tons of people in there, and they've had to increase staff on there. But where are their numbers?
You know, I don't know what their specific numbers are. What I can tell you is that during COVID, that was completely wiped out. We weren't doing any rehabs because a lot of those types of surgeries were put off. That is one of the more profitable, pieces of the healthcare campus. And I know those have picked back up as we've gotten past COVID here, but I don't know the numbers off the top of my head.
Any other questions? Thank you.
Yep.
Item 4, consideration of capital improvement projects.
Yeah, this one will be fairly easy for you. The highlighted rows out of the KIP plan are the ones that are pertinent to the healthcare or to the HHS board. So there's only one. It's replacement vehicles for the ADRC. So we have a rotation of the vehicles. They have different smaller buses, smaller vans, bigger buses that we rotate out. And so you'll see different dollar amounts in different years. It really just depends on which vehicle is being replaced in those years. So this is the capital improvement plan. So the process that we go through is department heads submit all of their requests. We put together an overall 5-year plan. We go to the standing committees then, that's where we're at tonight, and go over your particular sections of it to give you a first look at it and a little bit of input. If you say that's a really good idea or that's a really bad idea. From here then, we'll go to the committee of the whole in July. At the end of July, we'll go through for the entire county board then all of the projects. You'll make a recommendation, basically. A resolution will be drafted based upon that, approved at the September county board. It becomes a supporting document within the budget. When the budget's adopted in November, then we can move forward and start working on those projects that are within the first year of the capital project. So really, at the end of the day, you're only ever authorizing the next year, which will be fiscal year 2025 projects. When you look at this, if you see red numbers on there, the project numbers or the dollar amounts on there, those, if it's a project number, that's a new project number. You have not seen this project before. It's brand new to the KIP. If it's a red dollar amount, but it has a black project number, that's because we dramatically changed the dollar amount on you. So like the one down here, the $57 million for a jail expansion, not your project, you don't get to talk about it tonight, but that project increased in size and scope, and so that's why that dollar amount is red. Last thing then on this, when you get to the bottom and you look at the overall years, so in 2025, we have $13 million worth of capital projects. That's too much for us to cash flow. We can really afford maybe about $3 million per year cash flow to pay for projects. So we would require a $10 million bond issue. So timing-wise, how we would do that is once the county board adopts the budget in November, this dollar amount is locked in. So if this is still a dollar amount in November when you approve it, I will then come back at the December county board meeting and introduce an initial bonding resolution. So an initial bonding resolution requires a 3/4 vote of all county board members. So it has to have 15 yes votes. If you're absent, you're a no. So it has to have 15 yes votes. That initial bonding resolution is good for 5 years, up to the dollar amount that you've authorized in there. We can then go out and get bids on the projects and come in with a bond sale that's closer to the actual dollar amount we need. And that will take just a majority vote at some point in the future. So the big project in 2025 is the highway shop, the Hudson Highway Shop at $7.5 million. So say that's the project that's driving this. We don't start that project until after November, once it's approved in the budget. They'll go to design, so they'll be in design most of 2025, go out for bids probably at the end of 25 or over the winter for a spring of 2026 construction start. As soon as we get those bids, we would then be able to sell the bonds. So you may do an initial authorizing resolution in December of 2024. We may sell bonds in the spring of 2026. But that's overall how the cash flow for the capital project improvement projects work. That's all there is to it, unless there's questions.
Any questions?
Simple, right?
Great. More money. If there's no further questions on that, we'll go to number 5, Health and Human Services Strategic Plan Update, Communications Committee.
I'll just introduce Colleen in a second, but the reason we put this on the agenda was, I believe, in previous meetings, Member Lindeman asked for updates on our strategic plan as we went through. I remember you did. And we identified in our strategic planning process last year that communication was an issue within HHS. It's such a big department. There's positions that are all over the place doing different jobs. And so we formed a communication committee to address those communication challenges that we've had. And Colleen volunteered to be the Communications Committee Chair. And, and Colleen and our, at the time, epidemiologist, or was she health officer, Ellie Clausen helped take survey data and put it into a format that we could read and look at to see where some of these challenges exist. So I'll turn it over to Colleen so I don't steal all her thunder here.
Okay, so first off, I guess most of you know who I am. I'm Colleen Linder. I'm the Executive Administrative Assistant to the Director and also the Chair of the Communications Committee. So far it's gone well. Like he said, he asked me to come here tonight to give you a quick update on what we've been doing and things that have happened so far. Just going back a little bit, so like he said, it was part of the strategic plan that we all did as administrators. It started off with the UW Extension people helping us go through the whole process, coming up with themes and ideas of what we saw based on the survey results that they had done. And so the administrative team came up with one of them that was the communications need. So this was the initiative that was made, and you can see that one of them was to establish an HHS committee. So we did that. Like I said, one of the areas for growth that was determined after was to improve communication, which led to us making this committee. We have members from across all of the divisions, or we've tried to anyway. There's the list of names. So we have someone, myself, someone from the ADRC, Behavioral Health, CCS, Children's Services, Healthcare Campus, Records, and Public Health. So we began meeting monthly back in October, and Bob kind of got us started. We kind of had a charter to kind of get us started, but based on that charter, we thought we needed more information from the rest of the staff on what their needs are, what they're thinking, what communication looks like for them. So we started drafting a survey to send out to all Health and Human Services staff. So again, with the help of IT, which was very helpful and taught me lots, and then reviewed by HR to make sure the questions seemed okay. In March, the survey went out and ran for about 2 weeks. So people had 2 weeks to go in and complete it. It took approximately 10 minutes maybe to complete. And so what you see here is that the data was collected, and the results were shared first with Bob and then HHS staff. And so we continue to review the charter. But this was the way the survey looked that went out to the staff. So they received an email. They could click on a link to take the survey. So initially what we wanted to make sure is that we were capturing enough of the population across the whole HHS. So it wasn't weighed out too wonky. Also, we just wanted to kind of look at how long people had worked there. And then we started delving into what is it that you feel that you need more of, need less of, and then based on like whether they answered yes or no to a question like this one, then it would maybe take them to a question that they could fill in the blank. So we could get language from them of what exactly did they mean by their response. So there were several questions that were like that, and so we got some good information on those. So in this second part that shows you a different version of the survey is where Ellie Clausen came in. So we took the survey results. Ellie did it very easily with Excel spreadsheets and pivot tables and all the things that she can do. I did it by reading through all of the responses and kind of coming up in my brain, what do I see continue to be repeated? What are people saying over and over and over again? So between Ellie and myself, we came up with themes. So what are we seeing a lot of? So as you can see, first off, we had 121 respondents. And then you could see, based on the FTE counts, how many from each of the divisions put in a response. Then down here, it kind of told you over all of the responses, the percentage of people that responded. So we, again, back wanting to make sure that we were capturing a little bit of everybody, which we feel like we did. And then we came to identifying the themes. So the top 6 communication challenges were the communications with other departments, the communication not being consistent, communication with administration, a communication about new employees, and then email came up a lot, and the bridge came up a lot. So like I said, we read through the responses. We kept coming up with these consistent. So 27% of the time, other departments came up as a concern. Like, I don't know what's going on in the other departments. So these, you'll see like an example of a response. I feel that communication within our department is pretty good, but I feel that department to department communication is where the struggles are. I do use the bridge frequently and I pay attention to what is out there, but it covers the entire county. In terms of HHS information, it is not a good resource. So again, back to picking out themes. So again, one is department to department, one is the bridge, those types of things. So we went through, and Ellie was able to develop some good themes and then ways to pull them out. So then just this kind of gives you some samples of the responses that we got. Again, 19 mentions of other departments. You know, there's a lot of communication between departments, but it's not always clear how other departments can support each other. That seems to be a consistent thing where what is it that one division does that maybe will help me do my job? And some departments do a really good job of it because they use them consistently. So I feel like ADRC staff work a lot with economic support because they're trying to get clients connected to the services that they need. So I think they have a pretty good understanding. But then there's some other departments that maybe don't have that same understanding or know fully what they could maybe get from economic support for their clients. So that's kind of something that we see a lot. The siloed thing was something that came up a lot, and issues seems to be more across divisions. So again, knowing what the other divisions are doing, what is it that you do every day, how does that pertain to what I do in my everyday, seemed to be a consistent thing. And then again, the one that came up a lot was new employees, changes in positions, changes in, you know, I used to work here, but now I work here, type of thing. And so then there's a little bit of confusion at times as who I'm supposed to be contacting. Another consistent message was about admin, again, equal advocation, communication, the consistency, I think, thing came in there. So maybe one division hears it and another division doesn't, or one division hears it today and another one doesn't hear it till next Wednesday. Again, some of that is based on when teams meet as a group. So we're trying to figure out, is there a better way that we can consistently get a message out to everybody at the same time on things that affect them. And then the consistency across and the same message across. So as in life and as everything is, there's always sometimes a shiny penny that sticks out a little bit, and right now it appears to be that people are feeling like mental health and public health are being a little more recognized or talked about or getting the assistance they need. But again, I think if you ask the same question in a couple of years, you maybe would get a different answer. I don't know that, who knows, but again, that was something that we did notice, so that not consistent across. Employee status, so again, back to who's working, who's new, who changed positions, that type of thing. Turnover was a big one. So then we started asking, and mostly we asked these questions based on what tools, what's something that we can improve the communication with. So is it technology? Is it emails? Is it posters? Is it, you know, so we're trying to pick the brains of what is it that you want? How would you like to get this information? So we asked the question about, do people watch the town halls, which are put on by Administrator Witt and the staff? 69% of the people said yes, which I think is a pretty good number. And those that said no, though, it was because of time. We're too busy, I don't have time. I just don't have time, consistently over and over. There was a few people that said it doesn't pertain to me, I don't live in this county, so it doesn't pertain to me, or it doesn't have anything to do with my job, so I don't want to use the time to listen to that. But I would say, as you can see, 56% of the reasons they didn't, it was time. So I would rather spend that time doing my noting on my cases, or I need to go out and visit with a client, or I'm, you know, busy at the front window and there's just not time for that to happen. Then we just kind of asked about the things that we are currently doing. What are you interested in knowing, and what aren't you? So like the staffing changes, again, like I said, consistently came up. What the other programs are doing, you know, not so much interested in the budget process. But again, we just kind of asked that, how would you like to receive information? So again, 41% of them said via email, which was surprising to me because many of us talk about how many emails can we get in one day. But I think for that consistency, that's something that can go out to everybody at the same time and they can get the message. So I feel like that's where that played in. And then we have all staff meetings currently. So like quarterly, we try and hold an all staff meeting for the Health and Human Services. So we're approximately having 110 to 120 of the staff that participate in those. Probably 60 to 80 are in the building in one of our big meeting rooms, and the rest are on Teams. We started offering that option obviously during COVID and trying to capture as many people as we could and stay connected. So that has been part of that. So again, what do you want us to use this time for? So back to, we're going to use some of your time. How do you want us to use it? What do you want to know? What do you want to learn in this? Again, staffing changes, years of service, retirements, general expectations were a top one. A little bit of the kudos or shout outs to things going well, but then information about work that other divisions do was a high one. That's what we found out there, and trying to get my arrow, there we go. So back to then, how do you get your information? Do you use the bridge? Well, so an if developed, so one of the things we talked about is developing an HHS intranet. But the question was kind of asked based on if people aren't using the bridge currently, are they going to use something else? What we found out is people are using the bridge, 75% of them. So it's like, and when they said, when they answered the question no about why they didn't want another site, it was because they felt there would be one more place to go look for information. The hope with an HHS intranet is that it's very more focused. So when they need information about their job, if they need information about HR, about their time card, about that, that will still be the bridge. The vision, I think, for, and Bob can weigh in, and I think Rhonda is here. Rhonda is going to be our leader on this, we're hoping. Is it's going to be more health and human services focused. So again, what is your department doing? What's going on in your department? People feel like a division, let's say the ADRC has a congratulating their volunteers. People feel like they don't know about that until it's already happened, those types of things. So we're hoping to keep it a little more focused to HHS. Also, we found that people are accessing the bridge at least weekly, often daily, and if they find it user-friendly. So that was some good information. And people do go out there to get HR information. So with that said, so gathering all this information, we have met again as a group, dividing this information down. And so we're trying to now come up with our next steps. So what does this tell us? What can we do to make improvements? One of the things, which Bob has a director's report in the board packet tonight, people like that. So people have reported and said, though Bob kind of says, I'm not so sure about that, but they love to hear from Bob. They like to hear from the top. They like to hear the information. They like to know that he's the one that's saying this is what's going on, even though he talks about the Iowa Hawkeyes a lot in his, but they like to hear that. But what we're hoping to do is maybe add to his words something from each division in that little email that goes out. So what's going on in ADRC? What's going on in behavioral health? Did you hire somebody new? Did a position change? So that's one of the ideas we have, is just to kind of add to something we already have going on. Again, we already have the all-staff meetings. We'll probably stay a little more focused on what we see here as answers. And then the other thing is the bigger project, which was a suggestion in the original strategic plan, is to maybe build like an intranet page for HHS Focus, because we are such a big department. So the hope is that we'll continue to work on that, work on getting maybe some more feedback on, as that progresses, have enough people involved that we can have input on what it's going to look like. But so far, we feel like we've, made some progress, got some answers, got a little bit of a focus on where we should go next, and we'll go from there. Any questions, thoughts? Yeah.
Go ahead, Deb.
Well, thank you for that, since I asked for it. I appreciate it. I just have a quick question. How often should people be on the bridge? What's ideal? I mean, and are they told that during their orientation, or is it just left open to people?
I don't know that there's a specific amount of time. I think it's based on your needs. It's, a suggestion to go out there at least a couple times a week, because things are updated quite often. But again, there's a lot of information out there. So if you have HR needs, you can go out there and look at what do you need to do your job, what do you need to do for taking your PTO, or what do you need to do about bereavement. All that stuff is out there. So ways to do your job is out there. Your benefits package information is out there. So if you need to change your benefits for a life-changing event, how do I do that? Who do I contact? All that stuff is out there. So it depends on the person, but I would say you would want to go out there at least a couple times a week just to see what the updates are, because it does change. Sometimes daily, sometimes just weekly, but.
Any other questions?
I would just, thank you, Colleen, that was good. I just wanted to add that the goal behind this effort is to really improve efficiencies, time efficiencies, communication, to build some integration within the department between divisions, and kind of foster a culture of one department. The intranet site that Colleen mentioned, like an example of what we could store there would be HHS policies that somebody could find easily, would be documents that we want to share that are specific to HHS, or whatever news that we would like to share. So that's a work in progress and early progress, but that's the goal really, is to build in efficiencies and develop a culture where people feel like they're part of something. The healthcare campus is a bit of a struggle because of the geographical, difference of where they're located, but we're trying to figure out ways in which to communicate with them as well to make them feel part of one. Thank you again.
I guess I will just, to piggyback on the healthcare campus, we did, we had Sheena involved as part of our team. We did try our best to try and have them reply to the survey, but again, because of their jobs and how they do their jobs, it's a whole different beast over there. So we would really still like to make them feel more included. So I know there's some different plans in place that Adam has been talking about, and just kind of increasing the way that they could possibly receive communication, because a lot of them don't carry around a laptop all day like most of us at HHS do. They're carrying around call buttons to help their clients, and they're busy. So, but again, we do have her on the committee. We do ask for her input on how do you think You know, it might look different for them. It might be the flyers, it might be a handout, it might be a print off of the email that he sends that people can grab and read when they have the time. So, yeah, it'll maybe look a little bit different for over there, but we do want to try and improve that communication as well.
Thank you. Any other questions? Okay, we'll move on. 6, Health and Human Services Director's Report.
Thank you, Mr. Chair. I provided this brief report just to kind of give you an update of where we're at mid-year in 2024. I think it was just last month presented the annual report for 2023. So I'd just like to give a little insight into where things stand in the middle of the year so that you're better informed. And just, I won't go through the whole thing. I want to point out a few things if that's all right. We've seen an increase in-person traffic at the services center, so people coming in for various needs. I think based on what Colleen told me, a lot of those needs involve housing, involve utility assistance, involve mental health and addiction kinds of needs. It's anecdotal, but the perception is that many of the folks coming in have more severe or complicated kinds of situations that we have to help them puzzle through and figure out. That could be perception, it could be real, it's hard to measure that, but that is the perception, that we're just seeing more severe kinds of challenges that people walk through the door with. We do apply for a lot of grants. This year is no exception. We're applying for several grants, have been awarded some already. We've been looking at the ARPA positions that we've had funded through the board for the last 3 years or so. That money will, for the most part, sunset at the end of 2024. So we're always looking for ways to, if those projects were successful and showing promise, like the Western Wisconsin Health Project with Recovery Support Solutions, if something like that's successful, we obviously want to continue it if we can, and we look for alternative funding sources. That's sometimes possible, sometimes not. It had mixed results this year in terms of what we were able to come up with so far anyway. And then the closure of the Health Sisters Hospital System and L.E. Phillips, the detox center in the Eau Claire area, has really placed an increased demand on area hospitals and on behavioral health service providers like us. So just it's some options that were removed from the western region of the state that we relied on oftentimes. And it was everything from birth to 3 kinds of physical therapy and occupational therapy kinds of needs to, hospital needs to addiction and mental health needs. It places more stress on an already difficult situation in this part of the state where we don't have a lot of those high intensity environments that we sometimes need for individuals. There's some legislation that may help with that down the road, but not in the immediate future. The ADRC, real quick, is they see increases as we already know. The aging population and the demands that go along with that are showing up in terms of our service demands there. The ADRC did get they went with a new newsletter publisher that should save them approximately $40,000 a year in monthly newsletter costs. So that's good news. Krista Noon's very good at looking for any efficiency she can find and trying to improve their financial status. In Children's Services, as I said, the number of kids in out-of-home placement have dropped to about 66 at last I've heard, which is good, down from 100 and some. But those kids that are in placement are still in very costly environments, and those costs continue to be a challenge for us to manage the cost for inpatient care for some of these kids and kids in the youth justice system. Let's see, I'll just move along. I wanted to point out economic support, the Economic Support Division. As you remember, the unwinding of benefits began in, when did that start, Rhonda? It was in this spring? Ended this spring, roughly?
It ends officially the end of this month.
End of June, that's right, I got it right here, 6/30/24.
Since March of 20.
So people's benefits, they were retained during the pandemic or the public health emergency that was in place, and we couldn't remove their benefits from them. When that public health emergency ended, then the Economic Support Division had to go and determine benefits for people that were receiving them to make sure they were still eligible. It was a huge undertaking. It's still going on, but will officially end at the end of this month. The Medicaid director for Wisconsin, Bill Hanna, sent a nice message to economic support specialists during that Economic Support Specialist Week. And I included that in this report at the end of it, just so you could see the kind of message that he wrote. But it really speaks to the kind of effort and efficiency and really dedication to their work that this division has exemplified over the course of the pandemic and currently. And I attribute a lot of that to Rhonda Brown, who's just really done a nice job keeping all of the workers there. The retention was great for our economic support staff, and I attribute that to her leadership. The healthcare campus is, like I said, they've hired several new nurses and have some CNA staff that can work over the summer to fill some of those contracted staff positions, saving costs and helping to staff the nursing home. Their census continues to stay high, so that's good news for them. If we can get to a point where hiring allows us to open Kitty Roads for dementia care as we intend to do, that would be an obvious goal that we're trying to achieve. The WIC program, Women, Infants, and Children program in public health, does continue to increase in terms of caseloads. It rose 33% since 2021. That division also applies for a number of grants and have received several over the course of the first part of this year. Later this summer, Public Health will be releasing its Community Needs Assessment. That's where they conduct a community assessment of health priority needs and then develop a community health improvement plan to address those health needs that are identified by the communities that we serve. That'll be coming out later this month. They also have a review coming up from DHS, local health department review that they're preparing for. And then I just going to mention that the Comprehensive Community Services Division saw their census drop a little bit, or their enrollment drop a little bit. That was due to graduations from that program. And they have about 20 people currently in the enrollment process, so they expect those numbers to increase again. They're holding off on hiring for a couple of vacancies until those numbers increase. But I think that was kind of my report, unless you have questions for me on any of that.
Any questions? Oh, okay, thank you, Bob.
Sure.
Request for future agenda items. I was wondering if people would be if everybody's knows our HHS campus and been to the offices and been to the health center, and if people would be interested in taking a tour someday, or maybe having our meeting there. Just an idea I came up with, if people haven't met the departments, and
I think that's a good move.
if maybe we'll plan something like that in the near future, if everybody's agreeable to meeting somewhere else.
As long as they have cookies. We do the tour.
Pardon?
As long as they have cookies.
As long as they have cookies, okay. Bob, you're in charge of cookies. Okay. Any other agenda item requests? Announcements and correspondence. Dave had passed out some information. Did you have any comments on that? Or?
I'm gonna turn part of that over to Bob, if you don't mind. It's just, for those that haven't seen it yet, if you didn't notice the display that's out here in front, you take a look at it, and each one of those pinwheels represents, well, Bob, you go ahead.
June 15th was World Elder Abuse Awareness Day, and as you can see from the number of pinwheels, maybe you can see on the flyer that Supervisor Osnes passed out, there's a lot of pinwheels for representing the referrals that our adult protection services receive. Just noting, that our referrals in APS have gone up from 400 in 2019 to 583 referrals in 2023. And so far this year, there's been 300 referrals to that area. So the demands, and again, I keep saying it, but the aging population is going to contribute to these kinds of, unfortunately, these kinds of referrals for people who are either abused, neglected, or the victim of a financial fraud of some kind. So I give credit to our APS division or service area for the work they do and the increased demands that they're constantly dealing with.
Any other announcements or correspondence? Oh, go ahead, Bob.
I did. Great. Thank you, Chair. I received an email today from DHS asking for volunteers to be on an advisory committee for the Act 249 Urgent Care Crisis Observation Facility Rule Writing Committee. So I volunteered myself to be on this committee to advise DHS on some of the aspects of the rule as they develop it. This is the Regional Crisis Stabilization Facility that, well, there was three, I believe, 2 or 3 that DHS is charged to write rule language for and then fund going forward. So anyway, it looks like I'll be on that committee, and I should have some insight then to how this rule is developing and what kinds of regulations might be in place to oversee these facilities. I think there was one other announcement. I was just going to make an announcement about some grants we received. I don't need to go into detail, but there is one big one that applies to APS that Char Lopez has been working on with Amber Hahn, who's an assistant DA from Fond du Lac County. And it's a grant that would help to provide an additional partial FTE to the APS service area and some funding for supporting victims of abuse. There's much more to it than that, but that grant would be, if we get it, it would be up to $400,000 for 4 years and would assist us, we hope, in training and education and assistance around APS cases. I'm also writing a grant right now, would be the same thing, $100,000 a year for 4 years, so $400,000 for it's called a navigator position. It would be similar to one of the ARPA positions we created, a community-based case manager that goes in the community and assists people with getting connected to other kinds of help. Navigator is part of the DHS effort to build harm reduction systems within communities. If we get that, I should know by July something. No, September. I take that back. So I'll keep you posted on that.
Thank you. Any other announcements? No. Well, then I'll adjourn the meeting at 6:09. Thank you, everyone.